So iron deficiency anemia, what is this all about? I recently watched the documentary. It was a two-part documentary series called What Happened to Brittany Murphy. I'm sure you guys all remember Brittany Murphy from popular movies like Clueless. And this documentary just caught my eye. I ended up getting sucked in. It was a really good documentary, extremely sad. So if you have the opportunity to watch it, please do. But one of the things that kind of shocked me the most, it was a shocking documentary in general, but one of the things that shocked me the most was when I discovered that Brittany Murphy's HB or hemoglobin was 3 at the time of autopsy. My mind was blown. I was like, if you have a patient that comes into you in the emergency room or into your offices and has an HB of 3, you act immediately. That's a life-threatening anemia. So basically your HB or your hemoglobin is a measure of the level of hemoglobin inside your blood. And hemoglobin is a protein that is carrying oxygen around your body. And it's very important to have optimal levels of hemoglobin, because if you don't, then it can lead to some symptoms, which we'll get into in a moment. But ultimately, iron is one of the building blocks of hemoglobin. And essentially, if you don't have enough hemoglobin, then you're not moving enough oxygen around your body. And that leads to some of the symptoms of iron deficiency anemia. And so typically we would expect a woman of reproductive age to have an HB somewhere between 12.5 and about 14 or so. Just depending on different laboratories will have different reference ranges. But ultimately, an HB of less than 7 would be considered a severe anemia. So you can imagine when your HB is 3, that is life-threatening. And so, yes, Brittany Murphy was definitely going through some chronic situation at the time when she died. I don't want to ruin the documentary for you, but ultimately, that was one of the red flags, the things that kind of alarmed me about her autopsy results. And so what is iron deficiency anemia? Essentially, it's a low hemoglobin level that's caused by a low iron level. So there's multiple different reasons why someone may have anemia. You can have a B12 deficiency, you can have something like sickle cell anemia. These are some of the genetic types of anemia. But iron deficiency anemia is a very specific type of nutritional deficiency that causes your red blood cells to be very small and not hold enough volume. And so there's essentially 3 causes or 3 things that could potentially contribute to somebody developing iron deficiency anemia. And typically we know that there are certain age groups and certain populations that are at higher risk of iron deficiency anemia than others. For example, women of childbearing age are more likely to become iron deficient, and pregnancy also generally tends to put you in a state or a risk for developing iron deficiency anemia. But essentially the 3 causes or the 3 umbrella groups of reasons why you may be iron deficient is, number 1, if you're not taking in enough iron. And so just from the information that was presented in the documentary, it would appear that perhaps Brittany Murphy was not getting enough iron in from her diet, or getting enough nutrition really in from her diet. But essentially, if you're not eating enough foods that contain iron, then you could potentially end up with iron deficiency and then go on to develop anemia. So what are some of the foods that contain iron? Well, iron-rich foods, typically there's 2 types of iron, so heme iron and non-heme iron. Heme iron is basically the type of iron that we find in animal products. And so typically meat, poultry, seafood will all contain heme iron. But there are multiple different food items that also contain iron, but it's not in the heme form. So this would be what we would call non-heme iron. And so some examples of non-heme iron rich foods would include things like legumes, like different pulses, beans, chickpeas, nuts and seeds, green leafy vegetables like spinach and kale. Interestingly, dark chocolate also contains iron, as well as some foods that may have been enriched with iron. So, for example, certain rice or bread, or even certain cereals may be enriched or fortified with iron. So, there is non-heme iron in animal products, but there's no heme iron in non-animal products, if that makes sense. So essentially, if you're not taking in enough iron in your diet, then you could ultimately become iron deficient. The second kind of umbrella reason why you may develop iron deficiency is if you are not absorbing your iron. So you may be taking in enough iron, you may be eating enough iron-rich foods, but when it comes to your digestive tract, you may not actually be absorbing that iron efficiently. And this may be as a result of imbalances in your gut microbiome. So in other words, the health of your gut is important, because if you have a really inflamed, leaky gut, then absorption of certain nutrients will be affected. So there are certain extremes of that. So if you have an inflamed bowel because of inflammatory bowel disease, like Crohn's disease or ulcerative colitis, or even if you have indigestion and inflammatory symptoms related to your gut, so whether that's related to IBS or whether that's related to inflammation in your stomach, anything that kind of compromises the lining of your gut is going to affect how well you actually absorb iron from your food. And so your gut health becomes seriously important when it comes to making sure that your iron levels are kept topped up. Another thing that may affect your ability to actually absorb iron is if you are taking certain substances that may be blocking your absorption of iron. An example of this would be taking calcium in combination with iron. And so calcium generally tends to block iron absorption. And so if you are taking a calcium supplement or foods that are rich in calcium at the same time as eating iron-rich foods, then this may affect your absorption of iron. Another thing that can actually hinder your ability to absorb iron is something called tannins, which are present in teas and coffees. So these it's often advised that if you are eating iron-rich foods, that you don't take any tea or coffee either an hour before or an hour after consuming those iron-rich foods, because tannins in the teas or in the coffees can actually block iron absorption. On the flip side, you can actually increase the amount of iron that you absorb by ingesting vitamin C at the same time as taking in your iron-rich foods. And this is particularly important if you are really wanting to ramp up your iron absorption. So this may mean taking a vitamin C supplement, or it could even just mean eating some iron-rich foods some vitamin C rich foods at the same time as eating iron rich foods. So if you think of things like citrus or even strawberries, adding a bit of lemon on your salad, this will all help to enhance the absorption of iron via your digestive tract. Another thing that is important to remember is that non-heme iron can sometimes be more difficult to absorb than heme iron. And the part of the reason for that is because of something called phytates that exist in things like legumes and other pulses and beans. And so soaking these items overnight before you cook them can actually help to remove some of the phytates, which may actually be blocking iron absorption, and help you therefore to better digest and absorb the iron from those food items. So the third umbrella term, or the umbrella reason why you may be iron deficient, is if you are bleeding, so if you are losing blood. And so this is why it's so common for women of reproductive age group to be at risk or at higher risk for developing iron deficiency anemia, is because typically during a menstrual cycle, there's going to be a certain amount of blood loss. Of course, your risk of iron deficiency anemia is going to be higher the more blood you lose. But typically, let's say even if you didn't lose an extraordinary amount of blood in your period, but you're not taking in enough iron, over time, that progressive blood loss throughout every menstrual cycle is going to weigh your hemoglobin down. And so that's the third reason why you may be iron deficient. There's other ways that you could be losing blood that are not related to the menstrual cycle, though. Some of the common things there would include if you had an ulcer, for example, that was bleeding, or if you had a worm infestation. So parasites can actually latch onto the lining of the gut and cause these, what we call microabrasions. So like these tiny little scratches or scars along the gastrointestinal tract, and you can actually bleed through those. So that's a kind of somewhat obscure reason, but something that really is important to exclude and look out for, especially in children with iron deficiency, and also especially in areas where having worms and parasites is more common than perhaps in other areas. So we've already mentioned some of the kind of strangest symptoms of iron deficiency anemia. So restless leg syndrome is a syndrome where you get this urge to move your legs. Some people describe it as like an irritation or like a crawling sensation on your legs, but it actually it causes you to constantly be moving your legs and changing position. And sometimes it can affect your ability to fall asleep. Hair loss is another one of those symptoms of iron deficiency. In fact, there's multiple different reasons for hair loss, but we do see that people who have iron deficiency anemia will tend to have thinning of their hair. And then pica, which is that strange craving for clay or soil or chalk, is another strange symptom of iron deficiency anemia. It's quite interesting because my grandmother used to crave this particular type of sand or clay that used to be in a very specific spot near her home, and I think she used to send her kids, my mom and them, to go and collect this specific clay for her. And then my mom, when she was a teacher, when she was teaching, she would like munch on chalk every now and then. And I, growing up, from a really young age, I started like crunching my mom's clay pots, and then it progressed to getting sand and pieces of rock from certain areas. It was crazy. But people describe this like insatiable craving for either soil or clay, and then ice is another one. Some people especially crave the ice that comes from the freezer. Like, back in the day, the freezers used to kind of build up with ice, and I used to do this, scrape that ice off the freezer and munch on that. But essentially that craving is called pica. And it can be a symptom of psychiatric illness, but it also can be a symptom of iron deficiency anemia. So those are some of the weird and wonderful symptoms of iron deficiency. But some of the more kind of run-of-the-mill symptoms, and potentially even some of the symptoms that may be easily overlooked, is this fatigue. So people may feel like really tired and drained, and there's a host of reasons why you may be feeling that way. But iron deficiency is certainly one of those things that can cause this sense of just really being drained and really run down. Palpitations is another one. Again, there's many different reasons someone could be having palpitations, but an awareness of your heartbeat or feeling like your heart's beating really fast is one of those symptoms of iron deficiency anemia. Another one is getting really tired or short of breath on exertion. And that's not necessarily even like, running, around the block and or like exerting yourself really that much. It could even just be, and in the documentary it's described, Brittany Murphy says that she walked up the steps and got short of breath. Now, there could have been other reasons why she specifically was experiencing that, but it is one of the symptoms of iron deficiency, where you exert yourself a bit not even that much, and you get short of breath or really tired. So you have this almost exercise intolerance, like you can't actually exert yourself too much without becoming short of breath. Pale skin is another one. So generally speaking, when we examine patients, we would be looking for signs that they are pale. We typically look in the mouth and in the eyes or the conjunctiva. But essentially, if you're becoming pale, that is another sign of iron deficiency anemia. Then there are other things like sensitivity to cold, right? So people often with, cold hands, cold feet, I experience that. Certainly that could be a sign of things like thyroid disease, but iron deficiency can also tend to make you more cold intolerant. Dizziness, lightheadedness, confusion, especially like if you perhaps, get up from your seat and it takes you like a second to kind of stabilize. That could also be something else related to your blood pressure, but it could also be a symptom of iron deficiency. So I guess the take-home message here, because ultimately we need to know what to do with this information, is to get to the root cause of why you are iron deficient. So is it because you're not taking in enough iron? And if you aren't, then you need to try and increase your iron intake. Is it because you're not absorbing iron efficiently enough? If you aren't absorbing iron, then you'd need to focus on your gut health and try and do some of those things to increase absorption, like avoiding teas and coffees around eating iron-rich foods, trying to take some vitamin C, soaking your legumes and grains before you consume them. But essentially, you want to do everything you can to increase your absorption. And if you are losing blood, excessive amounts of blood, especially during your menstrual cycle, for example, it's very important to establish why. So oftentimes people will tell me that they have very heavy periods. I certainly had very heavy periods. And for a long time, I was kind of told that there wasn't really a reason for that until I insisted that I get further testing done. And so if you are one of those people who has very heavy periods, and when we say very heavy periods, we're really talking about periods that last for too long, so definitely more than 7 days. If you're doubling up on your menstrual products, so if you're having to use like a tampon plus a pad, like you're doubling up on your sanitary wear, that's important to take note of. If you are flooding your sanitary wear within a short amount of time, so like every hour, every 2 hours, etc. If you use a menstrual cup, you can actually quantify your amount of blood loss. So typically anything over 80 mils of blood loss per period is too much. Typically it should run about 50 mils max. And then also if you're having huge clots, so small clots are just a sign that your blood has been pooling a little bit, which may happen in the vaginal canal before the blood actually comes out. But if you're having huge clots, then this is also a symptom or something to look out for, so that you can actually be able to determine if you're losing excessive amounts of blood. And if any of those are you, then I would strongly encourage you to have a deep conversation with your doctor or healthcare practitioner to establish the reason why, because there are certain causes of heavy bleeding that can be treated, and perhaps we'll talk about that in an upcoming episode.